call me a god. You call me a god.
Good morning. My name is Carlos, and I am a patient here at the Livelifetaller Center. To be exact, I'm a quadrilateral patient. So I wake up at 7:30 most every days. First thing I do is I take my stomach protector pill, the Nexium. After that, I get up and fix a bowl of cereal or just about anything that's available for breakfast. And I will show you what a typical day for me is here at the Livelifetaller Center. As you can see, I'm still laying down. This is after obviously doing some of the things that I mentioned, including the limb lengthening for the tibia. I have very good mobility with no problems. You know, as you can see, I'm moving my feet up and down. I have a scheduled physiotherapy session today at 12:30. Typically that will last about 45 minutes. Shortly after that, I will walk a little bit more, either around the lobby or in my room, and then I will prepare my lunch thereafter. This is my room. I have this very nice window that allows me to see the outside and let the nice bright light come in. Also, on the other side, it's my kitchen. See that microwave over there, the refrigerator where I keep whatever needs to be refrigerated, and it's within reach, a couple of steps and you're there. On the other side of the kitchen is my bathroom. You can't see the door from here, but it's there, and that's the entry door to the room. So this is a very, very nicely equipped bedroom, which also includes a king-size bed, which is the one that I'm laying in, which is very comfortable. Across from the bed is my TV. But yes, we gotta have TV. We gotta watch Netflix, whatever else you prefer to watch on TV. I also like to mention the fact that you are never alone in this place. Somebody's coming to visit you routinely, whether it's the nutritionist, the nurse team. There's also a custodian team that comes and routinely picks up your garbage on a daily basis. Also changes your bed sheets and your pillow casings. This is a very, very nice situation to be in. I couldn't ask for a better place to do this surgery. Everyone is always very helpful and very happy to give you a lending hand, which is worth $1 million to me because attitude is everything, you know. These people are all wonderful. This is a phenomenal team that Mr. Sedat has put together. I just can't thank him enough because definitely get what you pay for in terms of service, attention, and I'm very grateful for that. It is 12 noon and now it's time for my second session of the tibia lengthening, which is the long method with the hex key. So I'm going to set myself up, get myself in position. As I mentioned in a previous video, this is a very easy method of lengthening. Once again, this is the long method that uses the hex key. The hex key is placed in this. So you got to make sure that you insert this correctly all the way in. Once you're all the way in, you're going to create a 90-degree angle. And as I mentioned, pretty good with angles, so I can visualize that 90 degrees is right here. So I'm going to turn up to that point. Now we will go to the left side and do the same thing. And now you're going to do your 90-degree angle as well. Here's your 90-degree angle. Very simple. Okay, and that's it. All it takes is about 1.5 seconds per side. As you can see, I'm doing very well. My steps are very firm and even. I have full mobility. I'm able to bring my leg up and down. Likewise with the right side with no problem. You must be careful. Do not twist your legs. So always pick up your legs as you're spinning around so that you don't put pressure.
What does it say there?
Medical team.
You wrote it?
No, the medical team. Well, because I'm doing good, so they wrote that for me. It is now 12:15 in the afternoon, and I'm getting ready to go for my physiotherapy session of the day. So I'm going to get up now. Yeah, as you can see, the elevator is a bit slow. There's 2 of them, but you know, considering my mobility right now, if I switch to the other one, then this one opens, and I gotta rush back to this one, so I'll stay here. Here we go. The barber came last night at 12 midnight, and he didn't charge me anything. He gave me a haircut for free.
Here?
No,
Why you didn't do it?
I'm gonna grow it.
Like, why did we buy the shaver?
For the hair.
But you said the barber come.
No, me. The barber came at midnight. I couldn't sleep. So I said, you know what? I'm gonna get up and give myself a haircut. Not too bad, huh?
It looks good.
Thank you. Are you my physiotherapist today? No. Ines. So we are waiting for Ines. My guy Ines. Enes.
Yes.
But when Enes is not here, guess who's my other guy? This guy.
What's my name?
Engi.
Thank God.
Thank God I got it right. After how many weeks?
2 weeks, I think. I don't
About
know.
2 weeks?
He was saying engine. Huh?
Yeah.
Engine is better.
My guy, give me some skin, brother. My physiotherapist, Ines.
Hello.
Who always does a phenomenal job. Very happy with her service. He typically begins the process by massaging, applying certain types of creams to alleviate whatever pain you got coming into the physiotherapy room. He will do the stretching after that. They have every possible type of equipment to help you with your physiotherapy sessions as you go along. Now, every physiotherapy session is a little bit different. They use different techniques as it is a requirement. They know what they're doing, so process. So what's my condition right now? What do you think?
Right now we are going really normal actually. I'm not saying bad. Your tibia swelling is take longer than I thought, but this is the 3rd week, so it's going down. So that's a good thing. Everything is going well right now. Like I said, the one thing, your tibia swelling is take a little bit longer than I thought, but it's fine. Your body is different, so I can say that. And right now you told me you have some pain around your osteotomy side, so I'm trying to reduce your pain with the super laser.
Okay. Yeah, the last couple of nights is when I had more pain there than usual. Right around the point where Dr. Halil break the bump on both tibias. It's funny though because the pain really only comes at nighttime when I lay down. During the day I try to keep myself busy. I have several sessions of limb lengthening between the femur and the tibia. I get up after every session to walk around in the room, walk outside of the room, down to the lobby, sometimes to the gym. Obviously trying not to do too much walking too, everything in moderation and according to my current condition.
We will be on crutches next week, okay?
Okay.
Prepare yourself.
Alrighty. Alright. We got through our physiotherapy session for Tuesday. Now we're going to take a little break and then we will meet in the lobby. I came down to the lobby so that I can pick something from the menu. It is lunchtime. Actually, it's a little bit past lunchtime, but because of my physiotherapy, I had to wait a little bit. But now I'm here. I'm going to be looking through this menu to see if I can pick something or see something that'll catch my interest. Okay, so I think I'm going to go ahead and pick this doner and rice. You know, I don't know if you can see it in the menu, doner and rice. Oh, by the way, they have a phenomenal selection with their menu. It doesn't matter what you like, they're gonna have it here. They have a wide variety of appetizers, salads, main dishes, breakfast plates, you name it. They have everything here. They have protein shakes, they have soft drinks. They don't recommend that you drink anything that's got too much sugar or too much salt. Is no good for your body while you're going through the limb lengthening. No caffeine. That one really hurt me because I like drinking coffee. I haven't had one single coffee since I came here. But anyways, we got to do what we got to do to make sure that we do everything right. Yes, and by the way, this is the lobby. It's a very beautiful place. Recently remodeled building that is now the Livelifetaller Center. As you can see, it's got a huge sitting area that will accommodate at least 12, 13 people here. In this section, there's a TV for those that want to watch movies. Also, they have a central air conditioning there, a dartboard, a foosball table. And this is another sitting area. that's hooked up to a game system. And God knows that we have a lot of guys that like playing games, so this is perfect for them. There's a big Bluetooth speaker over there, JBL, with a phenomenal sound that anyone can hook up to and listen to their favorite music. And if you look beyond, the kitchen is over there. That's where all the magic happens. For this menu here, they do all the different types of, it all happens behind that wall over there. My lunch arrived, and as you can see, I already started eating. It's very tasty. Good afternoon, and it is now 2 p.m., which is time for my femur lengthening session. So I'm going to begin now. I have all the equipment out already. It's on. I have it here in this small nightstand next to my bed because it is convenient for me to just pull the equipment out, right? I put it on top of the bed. I slide the magnetic device all the way to the other side. Now we are going to begin. We'll begin here by placing the magnetic device in the correct position in the X mark. Right there. We will press F1 to begin. This process, just the actual lengthening per leg, takes about 1 minute. I apologize, I said 30 seconds last time, but it's about 1 minute. So the total process here for each lengthening or each session takes about 5 minutes from the time that I take the equipment out of the drawer, place it all around me, and plus the 1 minute per leg for a total of 5 minutes. Each time that we lengthen the femur with this magnetic device, we are lengthening 0.33 for a total of 3 times per day. Okay, so now we're moving on to the right leg. Once again, you must place this magnetic device over the X mark. Okay, and once it's there, do not move it. Press F1 to begin the lengthening. So, after lengthening, it is recommended that you walk a little bit, your muscles, your skin, tendons, to the little extra stretch that we just did through the lengthening. Okay, so now we are here back in my room, and we have Omar, the head nurse, the boss of all bosses, here to change the bandages. This is like a weekly thing now, right?
Yeah, every 5 days we are changing the bandages. Now I'm gonna change it. I will check your wound condition. Also, if there is any problem or something like that, we're gonna see. I will check your stitches also, and also pin sites. And after that, I will give it to you all the information, general information about your wound condition.
Thank you so much. I appreciate that. So I was wondering why I still have the 2 bandages down there. Can you explain to me what that was?
You have some stitches on your tibias. For example, I can show you. There is the fibula joint locking screw. He put the 1 screw from inside to your bone from here for stabilization. And you have 1 aesthetical stitches over here. 1 more stitches is in here also. This is for fibula osteotomy. He broke your bone, fibula bone from here. That's why you have 1 more stitches in over here. Why we are using the bandages for stitches? First week after operation, because of the swelling and pressure, the infection risk also. That's why I'm using the tapes or bandages like here to stitches for protecting. And after a couple of days I'm leaving open. I checked all the stitches and pin sites also. As you can see, the stitches like nail enter stitches areas and locking screws and tibia osteotomy stitches also looking dry. It's healing now. I'm gonna leave it open, and next bandage time I'm gonna take it off all. It's gonna be fall off. As you can see, the same stitches also you have on the left side. Also left side healing is looking perfect. The fibula stitches also, everything is looking fine for now. And also the pin wounds is looking dry and good. You don't have any infection or you don't have any infection risk also now. Everything is looking clear. I'm gonna put the new bandages on it, and after 5 days we will check it again.
Okay, thank you so much. I appreciate the information.
Perfect. Next bandage time I can remove it all the stitches also. And let me see here. As you can see, smaller than ½ centimeter here also. Dr. Halil, you are the best.
this. In order to be good at anything, you have to be a little crazy. I'm a little crazy, just enough. I feel like a child is being put a diaper on.
You do it really good, like you put your heel first, and you try to left one also like that, and first heel, okay?
I feel excellent. This is the first time I've ever done this. I've seen it on previous videos with other patients, and I was always wondering how it would work. But now I know it's a combination of air pressure that's used to help you with your body weight. Therefore, it takes like 80% of your body weight, and that's how you're able to walk without any problems. I really like it.
Hello, this is Carlos again. So my day continues. After physiotherapy, I looked outside my window and the weather is phenomenal. The sun is out. It's not so cold, so I decided to come outside and enjoy this beautiful garden that's part of the Livelifetaller Center. And I am here with my two physiotherapists, Ingi and Inez. I was waiting for you to say the name.
I'm sorry.
The gravity, what do you call that machine? The gravity
Ultra-G.
Ultra-G, yes.
Don't go your Ultra-G sessions hungry. It's really important because you spend really lots of calories during the Ultra-G. It's important, and after gym sessions, or after if you go gym on your own, if you do some own exercise, you should eat protein sources right after gym in 30 minutes. Okay? That's why, like, if your sessions early in the morning, maybe you can have some carbohydrate sources before session. After session, you can eat your eggs like this. How many eggs are you eating in a day, by the way?
I'm gonna eat 3 only. Safe
Three.
too.
Okay. Normally you can have even more, but because of the cholesterol level, I'm just thinking that's why I said 3. Okay, because the mobilization also less than before the surgery.
Well put together team. Everybody's professional.
If you're happy, we're also happy. We're just trying to do our job here. And how many centimeters you reach currently?
How many centimeters? Well, we haven't received the x-rays yet, so we really don't know yet, but the speculation is that probably around 2.5, maybe 3 together, combined.
You just had first just one x-ray, right?
Yes. The nutritionist, Meltem, was just here. We usually go over the daily nutrition, which is a very good thing. Everybody here is active, helpful. Everybody does their job, which I'm very happy with. So we went over the nutrition for the day, the activities, what I'm eating, what I'm not supposed to be eating. Now this pretty much concludes the day, and I will be going to sleep now. Hopefully I can sleep all night. I will try. And then we'll begin the routine all over again tomorrow. Thank you.
They call me a